The cancer dialogue, and more specifically cervical cancer, and touching on the human papillomavirus and the vaccine thereof that has been rolled out across the country. And in studio for that discussion, we are joined by David Makumi, who is the Vice Chair of the Non-Communicable Diseases Alliance. Thank you so much for joining us. We also have Professor Frederick Were, who is the Dean of the School of Medicine at the University of Nairobi and also serves as an advisor on immunizations to the Ministry of Health, and among many, like I said, hats that you adorn. And we also have Dr. Abdallah Ziraba, who's an epidemiologist and currently the theme leader of the Infectious Diseases and Environmental Health at the African Population and Health Research Center. Thank you, gentlemen, for joining us in this discussion. And of course, most importantly to look at is that not a lot of people really understand what HPV is and why the vaccine has now been rolled out across the country. Maybe I'll start with you, Dr. Ziraba. What is HPV, and how, of what importance is it to have young women vaccinated against the virus?
Yeah. Thank you. Human papillomavirus is a virus, as the word goes. And majorly, this virus is sexually transmitted. And when it gets transmitted, it infects the body cells of women and men in the areas where it has been exposed, especially for women, the cervical area. And for some women, their immunity is able to clear off this virus. For others who are unfortunate, the virus sticks into the body cells, and those body cells change over time, and they become cancerous over a longer period of time being in the body.
All right. Yeah. And you've talked about affecting both men and women. And David, I mean, we are only seeing a target, the target is only on women. Why not men as well?
Yeah, thank you very much. Yes, currently the vaccination is available for girls age 10. Right. And really more for practical purposes. There's nothing wrong with a boy of the same age getting the vaccine. Actually, some countries with enough resources do vaccinate boys. But I would appreciate the burden of HPV in terms of the cancer causation is very heavy on women. But HPV does cause some cancers in men, like penile cancers, for instance. But in terms of the resources we have vis-a-vis where we shall get the best buys for the vaccine in terms of protection, then the entry age of 10-year-old girls was deemed appropriate. Yes.
Can we say then HPV is directly linked to cancer?
Yes, it is causes 99% of the cervical cancer cases that we see in this country, and more so in sub-Saharan Africa, are associated to the human papillomavirus. It is a cause of cancer, and that is why we are looking at HPV vaccination as a prevention for cervical cancer, which, as you know, is the leading cause of deaths among women, among cancers in women, and also the second leading in terms of incidences. Yes.
All right. And Prof, you as a stakeholder within the Ministry of Health in the country, of course, the vaccination and the vaccines had been rolled out a couple of weeks ago. What is the progress so far?
Correct you a bit, I'm not quite within the Ministry of Health. Yes. I work for the University of Nairobi, as you define my position, but I advise the ministry on practical and policy issues around all vaccines, HPV included. I actually offer that to other parts of the world, but largely my ministry, this is my home. The rollout has been very good. The base that we know, and when I leave here, I'll be heading to Western Kenya if I manage to maybe have a look at what's happening there. The rollout was started by the Cabinet Secretary, Cicely Kariuki, and I think it was received very well. The conversations we are hearing from the periphery are that the members of the public are excited about it. In fact, we are constrained to be saying we are confining them to 10-year-olds. We had intended actually to do it from 10 to 14 to take that entire group, but the numbers of vaccines available in the world generally, not just Kenya, cannot support that population. In fact, many countries within Africa have been are having to wait for another year or even two.
Right.
We are fortunate to be sort of fast-tracked,
Right.
so to speak, because we have a mature immunization program, which generally on assessment is usually found ready to absorb a new vaccine. There's a few requirements for that.
Right.
But I think as an advisor and as a pediatrician, which I am,
Right.
interested in child health in total, I'm excited about the rollout that I've witnessed.
So at this point, girls aged 10 years.
Girls age 10 years, and the hope is that as we continue with the girls age 10 years, there will come a time when everybody who passes 10 has got it. We are still hoping, in theory, that if we are allowed, we might still attempt a catch-up of the girls older, but that will be driven by supply, which is not produced locally, it's produced elsewhere. And it's rather expensive vaccine, like most of these new ones are. So we're actually fortunate. The government is actually contributing quite a bit of money to have it available to our population, and for that,
Which is for free.
yeah, for the population is for free, and we intend it to be free wherever it's delivered, whether it's delivered in Nairobi Hospital or delivered in my private clinic. It should be free. Someone can charge a little something for the swab that bought, but basically it's free because the government has paid for it. We have some available in the private market. If procured that way, then someone is free to use the commercial language. But the government has now made it available, and everybody who has a certifiable vaccination program is allowed to use it in the country.
All right. Now, Dr. Ziraba, I mean, there have been concerns quite rife on the safety of these particular vaccines. So I'm going to ask you this, even before we get into the details of those particular concerns. Is the vaccine safe?
Yeah, I can say very clearly that based on the available literature, based on the available best evidence, scientific evidence, the vaccine is safe. Of course, just like any other vaccines, there might be a few side effects, like pain at the site of injection, a bit of fever in some people, a bit of irritability, and in rare cases, some people may feel faint, some kind of faintness. But overall, this vaccine is safe.
Right, and really just take us through the process in which this vaccine is administered. Yes. Is it in phases? Is it an injection that you can take your young girl to the pharmacy or to the health facility?
Yeah, so meant to understand that the vaccine that's available in Kenya is going to be injectable or is injectable.
Right.
And it's being given to girls who are 10.
Yes, right.
And that's for programmatic reasons, but it could be given to any girl between 9 and probably 18.
Right.
And for the Kenyan program, the design is to have 2 doses separated by 6 months period. That should be considered sufficient to protect a girl against HPV.
All right, and David, even with the it's so the vaccine is administered in 2 phases.
Yes.
So one phase and then another one after 6 months. What is the reality on the ground with regards to, you know, people don't usually go for a second dose or a second dose of medication. Is this something that we should be, and the government should be able to look into to ensure that the girls have been able to take the dosage fully?
Yes, that's a good question. I must point out that most of the vaccines that are administered, childhood vaccines,
Yes.
you know, are administered in multiple doses.
Right.
Our people, our women, are so with it when it comes to vaccinations. And we must give credit to the Kenyan women out there. They are told that's 3 or 4 doses of polio vaccine or DPT vaccine that comes in 3 doses. They will not miss it. Our people keep those things religiously. So the whole issue of vaccines is not new to this country. Let's start there.
All right.
Our women, people have been vaccinated. Probably you and I have a little scar to show that we got BCG at birth, and our parents were told to go for come after 6 weeks or after 4 weeks. So the whole issue of coming back after a couple of weeks or months for a certain vaccine is not new. You know, they get measles vaccine at 9 months. You know, they will come for that. So once a girl gets a jab today, they will be told, 6 months from today, they will need another one. And the parents, those kids are still under parental care. The parents will ensure that that happens. And at age 10, once that girl is educated enough, is informed enough, you need to remind your mommy at 6 months, we need to have this vaccine given. So, and the other thing we must also appreciate is that this is not the first time people are getting HPV vaccination in this country.
Really?
This is the first national rollout. The national rollout, availing this vaccine free within the public health system. But the vaccine has been in this country for the last few years. Actually, the vaccine was launched in 2006 during the World Cancer Congress. So, but it has been available in this country through the private sector. So this is the first national rollout within the public health system.
All right. And why is it so important at this particular point if the vaccine was there, but a lot of Kenyans were not aware of the need to have the vaccination?
Yes.
Maybe not
yes,
a lot of Kenyans. I could help you there.
Right, Prof.
The private sector will purchase vaccines at whatever prices they are and then get their markup and obtain their percentage. As a practitioner in pediatrics, have done that. Now, for it to roll out to the entire public, we have to have a funder. Unfortunately for us, it's the government. Now, if you ask the government to pay for the entire the cost of vaccine at commercial level, we can't afford it, honestly. And therefore, an arrangement exists in the world called Gavi, the Global Vaccine Initiative, which avails co-funding, and the country contributes. So when that becomes available, and that became available for HPV some years ago, they now wait for preparedness of various countries. I think Rwanda got there ahead of us and Uganda. 2006. So now the other says us and we are ready. And readiness also means that our treasury has signed the check of paying the contribution of the country. So that actually is what has delayed us. The other handicap has been what I told you. There's also the supply. It's the vaccine, because of its cost, it had actually been largely meant for afforded by the bigger markets. And Kenya has got various levels of Kenya, which include as high market as US. That's why the private sector is talking about has been around. So basically, we waited for the time that it could transition into what our public health system can afford. And then our duty is to make sure we popularize it to the people and we explain to them its value like we are doing today, so that they do not come and expire because we are squabbling about something that is already known to be good.
All right. And we'll
so maybe just also to chip in there that this country did also carry out a pilot in Kitui County, just to see the preparedness Professor Were is talking about. How will this roll out? And the uptake there was excellent. From the pilot vaccination program that happened in Kitui. So it's not like...
So that was a success?
Yes, absolutely. Absolutely.
Have we been able to do an assessment after this particular rollout of before the national rollout?
I mean, there was a lot of lessons that needed to be derived from that pilot, which is what is actually informing this national rollout in terms of communication, in terms of acceptability by the communities, and in terms of even the model that is being used. Right now we are using a facility-based vaccination. It's available where vaccines are being given. The other models where you can have these vaccines being given within the schools. So all the lessons that were learned are what are informing how we are moving forward with this vaccination.
All right. And Prof, before I get to you, Dr. Abdallah, I mean, at the end of it all, in the long run, what do we have a timeline? Does the government have a timeline on achieving a certain agenda with this vaccination? Like, for example, the polio vaccination, that we're able to eradicate polio in the country to a certain extent. Do we have an agenda and a timeline to this extent?
For HPV?
Yes.
HPV, I'll maybe quickly tell you, we have the global agenda and which we all fall into when we adopt the HPV, is that the World Health Assembly is at the verge of saying that we have to eradicate HPV or cervical cancer in the world. The timing we are fumbling about, whether it's 40 years from now or 50, but to do that, because the disease which you get now and the cancer develops over a large number of years, we have to be eradicating the infection today, so that we'll then eradicate the... So we will join that bid. Our aim is to make sure that all our 10-year-olds from now are covered. Then we are participating in that agenda, so that the actual elimination from this cohort and all that are born after them will, by the time they would have been worrying us about cancer of the cervix.
So this is more of a prevention, addressing the prevention
of an infection that, if left ignored, and we have known that from the past, will have a chance of leading to this cancer.
All right, all right. And Dr. Abdallah, I mean, you interact with a lot of patients as well. How common really is HPV among women and men as well right now in this country? Yeah,
right now I'm not practicing, but the literature indicates that about over 90% of women are exposed to HPV in their lifetime. The good thing, not every woman who is exposed gets that permanent infection that translates into the cells changing into cancer.
All right.
So it's a very, very common infection. It can occur even in one sexual encounter. It's not something that is related to particular behaviors that people stigmatize.
Right.
Any of us, any sister, daughter,
but
brother.
This is a sexually transmitted virus, right?
Yes, it is. It is to a large extent.
To a larger extent.
Yes.
All right. And with some of the documents and, of course, reports that we've seen, HPV can cause different types of cancers. Oh, sorry, not different types, but it has different types of effects.
Right.
Someone can get what I've seen, genital warts, and on the other side also cancer, which leads to cervical cancer. Where really is the difference?
Yeah, so cancer, HPV is a virus that has different subtypes.
Right.
And if I remember very well, I think it's over 50, I think, to 90 subtypes. But the good news is only 4 are suspected to cause cancer. There's type 18, 16, 18, and I think 31 and 32 are known to cause cervical cancer, and 11, 16 are known to, I think it's 11, 16 are known to cause genital warts.
All right.
Yeah, so I think the vaccine that we're using covers both warts and cervical cancer. Prof, am I right?
It does cover the one we adopted here, the 4 component will be covering those.
Yeah.
All right. And does it mean that if someone has gotten genital warts, it will then lead to cancer at a later stage?
No, like I just said, the
they're
variant,
completely different.
The variant of the virus that causes genital warts is different from that causes cervical cancer.
All right.
So if you have genital warts, it doesn't mean that you'll get cancer. But it doesn't exclude...
Is there a likelihood?
But it doesn't exclude you having the type also that causes cancer.
So you could have different types of...
At any one time, you can actually have any of those subtypes at any one time, and even just to add is the fact that even people in monogamous relations, do get at any one time one subtype or another, or multiple subtypes.
All right.
Yes.
All right. So let's just get into a bit of some of the issues that have been raised by, especially the religious institutions, with regards to this particular vaccine. And Kenya is a very religious society as well, and we follow what our clergymen and women talk about. And one of the issues they've raised is the fact that chaste young girls and faithful individuals cannot be able to, are not likely to get HPV. So David, is this the true sense of it all with regards to someone contracting HPV?
No, it's not absolutely true. As we said, that HPV virus as an infection, at any one time, people who are even in marriage state or young people who are sexually active, at any one time, all of us will have a HPV infection. that we shall clear, and 90% as it were.
Does it clear by itself?
Yeah, the body, the natural immunity of the
Yes.
body just
Some
does
of
that.
us.
Right.
The only thing is you can't tell which individuals
Right.
or which
Okay.
individual where the HPV virus will progress to cause or to initiate the process
Right.
that causes cancer. Even for these girls that we are vaccinating at 10 years old, we don't know what will happen to them when they are 20 or 18, or when they start their sexual debut and get infected with HPV. So it's very deliberate to ideally get them before they're exposed to the virus, so that by the time they get exposed to the virus, their body will mount an immune response. They are ready for that. And that is the whole reason why you want to get them before an ideal situation where they've not ideally been exposed to the virus. But I mean, we all get really all exposed to this, only that you can't tell which individuals among all of us
Right.
will get this progression to cervical cancer. And that is what, we see all these women. We would not have been able to predict that
Right.
this woman who gets HPV exposure will get that progression, and this one will clear it naturally. You can't tell that. We don't have a mechanism to do that, Prof.
Yes,
On,
Prof.
on that point, I have lots of respect for religion myself.
Right.
I actually raised, and until now, over 61 years, I've been a Catholic.
Right.
And I suspect I'll stay that way for the rest of time.
Yes.
But I'm also a scientist. And I also know a bit of the epidemiology my friend is talking about. The fact that I can prevent cholera by washing my hands, that's what making me run away from the vaccine.
Right.
I'm all for all the things about girls being encouraged and mentored not into early sex. But I'm not to wash away another intervention which can work together with this one.
Right.
Yes.
I'm not saying there's anything wrong with that. That should be done. But if anybody can put their hand up and say that you can completely come and make sure that the 624 million girls that will be born in this country this year can be controlled basically by that, I think we'll be lying to ourselves, whichever side of religion we are. Yeah. So I'm quite happy with all those advices be given. But under no circumstances shall I wish away another intervention which can add to that
Yes.
and even make my girls safer.
And I
I would
think
have, yeah, that's really my view.
Yes.
Yeah.
Yes, David.
during the launch of the vaccine by His Excellency the President
Right.
in Mombasa, we saw no less than the Catholic Archbishop of Mombasa, Archbishop Kivuva, they are present.
Yes.
Certainly a mark of his presence, a mark of endorsement. So again, we as practitioners, as civil society, men and women of good, we all belong to certain religions.
Yes.
And certain convictions and persuasions. But definitely, I know that we hold our personal opinions, but that does not necessarily mean that that's the opinion of the entire church. So we also do respect those who hold certain views, but the greater good must prevail. The good of protecting girls from cervical cancer in future.
Yes,
But
Doctor. Yes.
just to add, I think it's not just the church or the mosques where the things are being spoken about.
Right.
I think it happens.
Even within
it happens,
the communities,
in the communities,
especially,
there's a lot of, if I may say, fake news around the benefits and risks attributable to the vaccines.
Right.
But just like any other health intervention, whenever a new intervention comes, there are always skeptics, there are always false information that goes around, and often it moves fast and it's more convincing than the real truth. So part of what health education should do is to try and reach as many people as possible with the right information about the benefits, and I think everything should be fine.
All right. And a question here from someone who asks, I've heard of a pap smear test. What does it mean? And can I detect that I have HPV using a pap smear test? I'll start with you, Dr.
Yeah. So pap smear has been the gold standard of early diagnosing of cervical cancer, where they put an instrument that looks at, you can call it a microscope, that looks at the cervix, that looks at the cells, they take samples, and then the people who are trained to study the abnormal changes of cells can say, your cells are normal or your cells are changing, they're becoming abnormal, and therefore you need an intervention. If that's captured early, they can prescribe for you an intervention.
All right.
And we have a short list of interventions that can cater for that. But that has been the gold standard in the past. The problem is it's quite expensive. Many times.
So many people cannot afford.
Many people cannot afford. Not many hospitals have that equipment. So it's not a very, very effective way of catching cancers early.
All right.
Yeah.
Now, Prof, you know, this vaccine, like you said, has been rolled out by the government together with other partners who include Gavi. And of course, for instance, Gavi decides to pull out from this particular program to support the government. Are there strategies that have been put in place to ensure that this is sustainable in the long run?
Oh, that's the work that we are at around the clock, but I think I must speak firmly for that.
Right.
We are aware as a country that we shall be weaned off the support by Gavi in 2027.
All right.
And that information is
So in the
available
next
in the
few
ministry,
years.
is available in as they're doing their planning, they're aware of it. I'm beginning to see the word immunization appearing firmly in the budgetary allocations.
Right.
It of course means that we shall continue agitating, and I would be proud if we left earlier, because we're proud of the country to afford your own health anyway. It's not anything that should be begging, but we are begging for a period. I can say that I'm aware and I constantly see preparedness towards that transition from Gavi. And our approach to universal health coverage at first primary health care is all fixing that direction. Yeah.
All right, and David, even as we move forward, would you say we are at a comfortable place as a government to ensure that we're able to deal with this particular problem at this early stage, to ensure at least, you know, our girls and women in future are protected from cases of cervical cancer?
Yeah, speaking specifically to cervical cancer, but of course looking at it in context of the larger cancer control issues, I think the one cancer that we know what we need to do, it's cervical cancer, vaccination, primary vaccination, which is we are doing.
This is something that has been established that we need to do.
There's a very, very clear roadmap of even the targets, 800,000 girls. The other thing is the issue of screening, which the fact that we are vaccinating girls does not mean our women should not go for screening. Screening must continue. And I mean, the doctor mentioned about pap smears, but we also do have HPV DNA screening that will tell a woman whether they actually have been previously exposed. So there are a number of screening modalities, and women need to continue going for screening. So again, that is available within the public health system up to health center level as or different modalities for cervical cancer screening. But while the woman is going there to be screened, they need to also get their breasts checked. In an ideal situation, they should have an essential non-communicable disease screenings, because you're the same woman there. So if you take your girl for HPV vaccine, someone needs to screen the mother, whichever modality they use. They can check her blood sugar while at it and check her blood pressure, because it's the same consumer. We are not talking of a woman with a 10-year-old. Is that same person who we must offer a comprehensive package so that we don't vaccinate her baby and herself. She's never had a cervical cancer screening. Actually, the stepwise survey that was done in 2015 revealed just about 20% of women have ever been screened for cervical cancer. So those two things must go hand in hand. We must mobilize women to get screened for these cancers. So as a country, I would say we have a roadmap. We need to put more resources so that whether there are mammogram machines that were availed through the MES project, you know, are they being used, and get our population also to demand this. Health is devolved. They need to demand this from their CEC for health. What is happening? We are rolling out HPV through the national government, but they should get screening through their county governments and demand for that.
All right,
yes.